5 of the commonly asked medical questions by the general public. How do people end up with sickle cell anemia? Can one get UTI through sex? Can people with high blood pressure exercise? Are stomach ulcers curable? How comes there is no cure for HIV yet? My name is Mwanguzi Shadrack, your doctor from Health Touch Uganda, and I'll be glad to share with you concerning these questions. So the first one, how do people end up with sickle cell anemia or sickle cell disease? Sickle cell anemia or sickle cell disease is one of the illnesses that are inherited from our parents. Just like a child is born and the nose, the eyes, or any other part of the body resembles that of one or both of the parents, is the same way how this illness also comes about. For a child to have sickle cell anemia or sickle cell disease, it means both the parents in their blood or in their genetics or in their DNA, they have a component that is responsible for causing sickle cell disease. So if a family has a child that has sickle cell disease, it means both the mother and the father in their blood, they have a component that causes sickle cell disease or sickle cell anemia. Then one would wonder, how comes the rest of the children? Okay, it is also possible because at the point of fertilization, the sperms, for example, that come from the man are of different types. So if a man has a component that causes sickle cell disease, it means some of the sperms that are going to be formed are going to have that component and others may not have it. So if the sperm that causes sickle cell disease is the one which interacts with the egg from this mother, which is also responsible for causing sickle cell disease, then the child will have sickle cell disease or sickle cell anemia. That's why we advise people before getting married to go and get screened, because we can know if there will be a chance of any of your children to have sickle cell anemia or sickle cell disease. That is the level at which it can be prevented. Later than that, if the two of you have that component in your genetics or in your DNA, then it means you stand a chance of producing children, or at least a child who has sickle cell disease. Can one get UTI through sex? UTI is also known as urinary tract infection. The answer is no. UTIs are not sexually transmitted. What confuses people at this point is there are two illnesses. We have UTI, urinary tract infection, then we have STIs, or sexually transmitted infection. Now, because the two of them involve private parts, it makes one think that both of them can be sexually transmitted. But for urinary tract infections, infections like bacteria, viruses, fungi that go on and invade the parts of the body that are responsible for making, transporting, or storing urine. So those parts include the kidneys, the tubes that lead from the kidneys to the urinary bladder. Those are the ureters. Then the tube that leads from the urinary bladder outside when for example, someone is urinating, and that is called the urethra. So any infection attacking those parts is also called a urinary tract infection. And those ones are not sexually transmitted, but they are commonly hygienic kind of illnesses, whereby maybe you go to a place that is a bit dirty, you urinate there, you sit on that toilet, or you shower from there. Sometimes you can pick up those infections, like commonly bacteria, from those places, and they access your urinary system, and you get what we call a urinary tract infection. Of course, some people at a higher risk of getting them, like the women are more at a risk than men, especially when they are pregnant. Pregnant women stand a higher chance. For men, there could be other conditions. For example, you have an enlarged prostate, so the flow of your urine is not efficient, or you have had a recent instrumentation. There is what we call a urinary catheter, where they insert a tube through your penis. That can also predispose you, especially if it stays there for a longer time. There could also be other conditions like people with diabetes. It's easier for them to get urinary tract infections, and so on and so forth. But if it is a urinary tract infection, it is not sexually transmitted, because for sexually transmitted infections, it's important that one is treated together with all their sexual partners until the symptoms actually resolve. But for urinary tract infections, there is no need to treat the sexual partner unless if they also have a urinary tract infection that is confirmed on laboratory investigations like urinalysis, where we check your urine in a microscope and on a strip to confirm if you have a urinary tract infection. There are clear There are demarcations in the nature of symptoms that people get. For example, urinary tract infections commonly cause people to have a bit of burning, especially on passing urine. They have this lower back or lower abdominal pain. They have this urgency when someone feels like urinating, they want to urinate there and then, or the number of times you have to urinate in a day kind of go high. For the sexually transmitted infections, usually they are associated with a discharge. It can be a discharge both from the penis or the vagina. It can be of certain color, a bit yellowish. In some people it's greenish, reddish, and it's usually offensive. It has a very bad smell. Yeah, and sometimes these sexually transmitted infections can also cause wounds in the genitals. It can be clear wounds, or it can be those blisters, like small swellings. And if you have any of those, you need to also be checked and be treated commonly for an STI, sexually transmitted infection, together with all your sexual partners. If your sexual partners are not treated, you will not have total improvement or total recovery. So, can people with high blood pressure exercise? And the answer is yes and no. High blood pressure, also called hypertension, is an illness that's associated with elevated blood pressure for a long time. Now, the longer the time you spend with this high blood pressure when it's not controlled, the higher the chances of getting damages to essential parts of your body, like the heart, the brain, the kidneys, the eyes, the blood vessels, and many other parts of your body. Now, if you have high blood pressure and it has caused damages to parts of body like the heart, and the heart is now weak, you have what we call hypertensive heart disease, or you are even in failure, you have what we call heart failure, it means you cannot tolerate strenuous exercises because your heart is not able to support you in such instances. Because when you're exercising, you need a lot of energy, and that energy is produced by breaking down the glucose and the sugars in your body, and that whole process needs oxygen, and this oxygen has to be delivered. So when you're exercising, this oxygen has to be delivered at a faster rate to those muscles and those other parts of your body engaging in the exercise. And so the heart has to push blood to run at a very high speed so they can deliver the oxygen, the glucose, and everything needed. So if your heart is weak, it may not be able to do that for you, and if you try to strain it, you may get other complications. So for someone who has hypertension that has caused such complications, you are not supposed to engage in strenuous exercises. Yes, but if you're someone that has hypertension or high blood pressure and you are on treatment, your blood pressure is now controlled on treatment, you don't have, or there is no evidence for complications like I have just mentioned, you can actually exercise. There are even sports people, there are athletes, there are footballers who are known hypertensives. They have this illness that causes high blood pressure, but they go ahead to do all those strenuous activities like playing a match for 90 minutes or running for hours without having issues, just because their blood pressure is controlled. That's why we advise that everyone gets their blood pressure checked, and once it's found high, you go ahead to heed to the advice from the professional health workers. Are stomach ulcers curable? The answer is yes and no. Stomach ulcers are wounds. Some people just simply call them ulcers. Yeah, ulcer means wound. So if you have wounds within your stomach, they can be caused by a number of things. Commonly, there is a bacteria which we call Helicobacter pylori, or simply H. pylori. This bacteria, if it is not eradicated, if it is not killed completely, then your ulcers are not going to heal, because it will continue to cause issues in your stomach, which will give you the symptoms of ulcers. That's why it's important, if you're the kind that says, me, I have ulcers, I have ulcers, I have ulcers, you go to a health facility, you may either check your blood or check your stool to confirm if you have this bacteria. If the bacteria is there, you will need to take medication for it. Usually we give 3, 4 or even more different types of medication for the complete or total eradication of this bacteria. Now, once this bacteria has been completely removed, you might stay on some protective medicine that reduces the amount of acids produced in your stomach to allow these wounds to heal. You see, but for some people it may not be this bacteria. There are other things that can put one at a risk of getting ulcers. Things like stress, people who are always stressed, people who take alcohol and smoke, people that eat a lot of spiced foods, there is a condition which causes a lot of acid production in your stomach. Usually there is a tumor or the mass that causes a lot of acids to pour in your stomach. So if all those things that put you at risk are not stopped or are not dealt with, then chances are high your ulcers are not going to heal. You keep taking the medication, but for as long as you're smoking, taking alcohol, the ulcers will be there. There is another important one. There are painkillers or certain medications that we call NSAIDs, non-steroidal anti-inflammatory drugs. Those medications also increase the chances of one getting ulcers. So if we are giving you treatment for ulcers, but you're continuing to take such medications on a regular basis, I'm talking about medications like diclofenac, ibuprofen, aspirin, and so on, it means your ulcers are not going to go away. So in the treatment of ulcers, it's important to identify the cause, deal with the cause, and then you will be okay eventually. But because most of the people don't deal with the cause, it gives an impression that ulcers are not cured. So yes, ulcers can be cured, but what causes them to be cured can be tricky sometimes, making it look as if they are not curable. But I want to caution that even when you are cured of ulcers, you are still at a risk, and so you need to take precaution, yeah, because I said ulcers are wounds. So if you have a wound somewhere and it heals, it's going to leave a scar behind, and this scar tissue is not going to look like the normal tissue or the normal skin, you see. And it means there is a point of weakness at that point, you see. So it's the same thing. You are going to have a scar left behind in your stomach, and it will be easy, very easy for you, if anything happens, to get the symptoms of the ulcers again. So if you're someone that has ever been treated for ulcers, even when you don't have symptoms at all, even if it takes about 6 months or a year without those symptoms, it's important to avoid taking such medications that predispose you to getting ulcers. The medications, most of them are painkillers, the ones I called the NSAIDs. It's important to avoid smoking and taking alcohol, a lot of alcohol. It's important for you not to be stressed all the time, and to do away with all foods that get you those symptoms like heartburn. If when you eat a certain food you get heartburn, then it's important you reduce or even stop taking that particular food. How comes there is no cure for HIV yet? HIV, this virus, human immunodeficiency virus, is very tricky. It's very stubborn. It's the kind of virus that keeps changing its form every time, because the viruses produce or multiply in the bodies of human beings, and every time they multiply, the new ones that form are different, a bit different from the old ones. That's how tricky it is for this particular virus. So it means it's hard to get a specific agent that kills these viruses, you see, because it keeps changing itself. It keeps getting us new forms that we probably have not seen before. So that's why it's a bit tricky, and up to this time we've not yet been able to get a cure for this virus. But the good news is we have been able to come up with medications that can slow down or even stop, for as long as you are on them, the multiplication of these viruses, to the point that for someone who has been taking the medication properly, as prescribed on a daily basis, you go for checkups, you go for follow-up and all those things, the medication will stop or greatly slow down the rate at which these viruses multiply. And when that happens, you will have no symptoms of the illness at all. In fact, you will live on normally like any other person, because the numbers of the virus in your blood will be very low, very low. There is what we call viral suppression, where we check and the number of the viruses are very low, and they are not posing any risk to your life at that point. And at that point, actually, you don't even transmit through sex to your sexual partners. You see, that is a point when we say someone has viral suppression. We can even check and we don't detect the virus in blood, and we give you a report and we say the virus cannot be detected in your blood. It doesn't mean you will not test positive for HIV, because the tests we do may look out for other things, not the virus itself. Yeah, but you are not, the virus is not detectable in blood. So we have the medicine that can do that, but we don't have the medicine that will give you and declare you free from HIV as yet. But there are a lot of research studies going on, and hopefully one day we shall be able to come up with this cure. But for now, the only hope we have is the antiretroviral therapy, all the ARVs, all the drugs that we give for people that have HIV before it gets out of hand, and to restore their health to almost normal. Yes, so those are some of the common questions that are asked by our people. I hope you found this impressive. There are a lot of videos that we have made concerning different health conditions, first aids at home, and so on. So you can check out our YouTube channel in the names of Health Touch Uganda for you to learn of those things that we have been able to talk about. And if there is something that you want us to address, a question, something that bothers you, feel free to ask. We shall also find time and respond. Inquiries can be made on all our social media platforms: Facebook, Instagram, Twitter, YouTube, or WhatsApp. If you want to get direct access to any of our WhatsApp groups, send a message to 079 001 3340 and ask any question or ask to be added to any of our WhatsApp groups. Yes, once again, Mwanguzi Shadrack, a doctor from Health Touch Uganda. Follow the light.